Evening everybody, it is Sunday the 27th of July, current time is 6:21 p.m. You don't feel too good. Welcome back to OK Aussie, I'm Matt, that's Dyan. Dyan's a person who's got a combination of rare genetic chromosomal disorders, particularly 22q11.2 deletion syndrome, and I think we're going pre-ictal, the phase, just before our seizure. So 7 minutes ago, she started to feel some nausea. She's had some ondansetron, 4 milligrams sublingual. Still feels sick. We're just prepping the room just in case it is a seizure. Her temperature is 37.0, so not in a fever state. High, but not in a febrile state, so that's a good thing. Just going to take some blood pressure. What are you doing over there? Can I get you lying where you're meant to be lying? Thank you very much, Lee. Now your hot pack is off, so we're just going to take...
No, we don't want hot pack. Oh, I'm cold.
Hot pack is off.
Oh.
Zara is there. It is 11 degrees Celsius outside. Room temperature is 21.9 degrees, so very cool and freezing, really. Cold and chilly days here in Perth.
We turn the heater up.
Not for the moment, thank you. Now, apart from having nausea,
Yes.
tics with Tourette's, which is the motor tic action that you've just seen then, Dyan closing her eyes and becoming a little bit less cognizant. Nausea, pre-ictal, is quite common as well. She's also mentioned the feeling of dread. Now, sometimes it can be dread, sometimes it can go into a Alice in Wonderland experience, dystopian, weird and wonderful, confusing. Time slows down, but she's saying it feels like it's coming on slowly. Not a good thing.
No.
So the temperature being only 37, we're not going to give Panadol Osteo to actually do anything there. She's showing to me at the moment coldness, but she's not totally with it. Blood pressure is 104/73. Now remember, Dyan's normal should be 85/65. Pulse is 71. You were wanting custard. That ain't happening right this second.
That's my happy food.
It's your happy food, your happy place. Right, well, it is evening time. Now you've taken the first sets of your night medications. Oxygen sats are 95, but flapping around. Heart rate 62 and flapping around. Let's double check, because memory-wise, you may forget. Now, Google Home Automation is what we use, and that would have triggered you to say, hey, take evening. You haven't taken the gabapentin or the Panadol Osteo. That's okay about the Panadol, but do you need the gabapentin? No. Okay, what we are going to do, that includes a clonazepam already, so you've already had a muscle relaxant.
Yeah, already have.
I'm bringing for the medicinal CBD. Can you turn onto your back, please? Thank you. Sorry to be a pain. We're going to give the medicinal CBD.
Bossy,
I always get bossy, don't I?
A little bossy.
Incoming. Good girl. Hold that in your mouth.
I get it and all.
Just let it absorb in, and then sublingually. Hey, Max.
I got my fresh jammies on.
What, sorry?
My fresh jammies on.
You have fresh jammies. I've changed the sheets. You have fresh jammies on. You're doing well.
Ooh. Max.
Oxygen stats are 97, heart rate 76.
Max, come here. No.
Yeah. Just for the moment. I know. How's the nausea feeling at the moment, though? Okay, we're going to play this up and down game, are we?
Breathe.
Not too far. That's too far.
Don't hang over me.
Okie dokie.
4 meters back.
4 meters back. Social distancing rules, not going to be
I'm
applied.
going to get the t-shirt.
You're going to get the t-shirt, are you? Just in case you do feel nausea. Now, the muscle relaxant, the clonazepam 2 milligrams as part of the night medication, should actually get in front of the dystonia, but that's actually happening right now. You've got blepharism with the eyes being affected, so the eyebrows and the eyelids. The pre-ictal stage, the stage or the phase before a seizure is ictal. You've now got lip pursing, part of the oromandibular, so you've got the jawline engagement, the lips, probably the tongue. So we've got a segmented cranial dystonia starting already. The muscle relaxant that you've only just had should be actually helping you to reduce that. Yes, you can actually have another anti-nausea because you've only got, working on 4 milligrams, you can have 8 milligrams at a time. And that's sublingual, so they're poking on your tongue. 6:28 p.m. Second on Danzatron now applied. You also had the medicinal CBD THC 1010, 0.5 mils. That'll also help with your nausea, inflammation, pain, and relax from the seizure, we hope. I can assure you, you don't want one. Let's hope that you don't have one. Fingers crossed. So, is a seizure going to happen today? What's your thoughts, Dyan?
I know.
You don't know.
I know.
You know. So you're feeling pretty sure that a seizure is going to happen. At the very least, we're going to get some dystonia. Dystonia is contractions that you cannot control of muscles that will force the body or the posture of those muscles into weird contorted positions. They might cause them to fibrillate, to twitch and shake. And at the moment, what we're getting here in the face is exactly that with a segmented cranial dystonia. Now, she might get focalized dystonia across the feet or the hands. She might get generalized dystonia, which will affect the whole body. She might get axial tilt, which affects the neck. We'll wait and see. But the noise is never a good thing. Normally, she won't be actualized sick. Thank God for that. But it'll feel like that. You used to in the old days. Correct. Now, you've already had the last of the sodium valproates today. So you've had 3 of those, 200 milligrams throughout the course of the day. So that's your seizure medications, though you're a bit below therapeutic levels, and you have emptied your bowels. So what are our indicators for seizures? We were talking about that a little bit earlier today. 3 things primarily for Dyan. Pain.
I'm overdue for custard.
Pain has been a big one. So Dyan has had a lot of pain, full body, and headache and migraines with the wafers, rizatriptan wafer use. That's the first thing. Sleep has been very irregular last night, particularly, but over the last 8 to 10 days. So lack of good quality, in normal duration sleep, irregular patterns, those things are not helping. Stress levels have been high last week. Those sort of things don't happen. And of course, the worst case scenario for Dinah is the bowel medications for the gastroparesis. She's been having to have medications to try and flush the bowels out. That changes the whole electrolyte imbalance. We know that her potassium has been low. That's why she had the heart event a few days ago with hospitalisation. We've increased the potassium iodide intake, but that should also help. That should also help the dystonia. No, having 22q and heart-related issues, predominantly, exactly what happens.
Simple thing. That's a
So,
simple fix.
let's see. Excuse me, Mr. Max. Mr. Max is down here. Relax. Boop, boop. Now, what else is happening in your body? Can you tell me?
Maybe the potassium's make you feel sick.
I doubt that at the moment.
You don't know.
I doubt that. A lot of bowel movement. She hasn't had any bowel movement for many, many, many days, but over last night and today, she's had significant quantities of that.
Social distancing.
I'm going to socially slap you in a moment. Max, what do you reckon? Or are you just going to go and bug your brother over there, which is Willow in the tower?
Mummy.
Yeah, you just look at her from a distance. Social distance, buddy.
He's nursing me. He knows.
Now, Dyan has been up and she's done a thing. So we've had a bath today, a walk-in bath. That process is exhausting. It does affect the orthostatic intolerance, the POTS side of things, and that can also affect the post-exertional malaise. Doing an activity, which is where she went and socialised in her wheelchair, and for a short duration, is still an activity. And that's probably a key catalyst to the trigger of overdoing things today.
I had to pick an outfit, isn't it?
Picking an outfit's a challenge for you, isn't it?
A lot of choices from Shein.
Too many choices from Shein. So we're doing a bit of a wait and see. It's currently 6:31. We're waiting to see what actually eventuates here. You think your toes are needing clicking, or are your toes...
No, don't take those off.
Okay, I have to because I need to see. The toes are soft, which is good and malleable. They're not actually going into a focalized dystonia. That's a nice thing. Let's just do a bit of click. She does have ehlers-danlos, hypermobility, and that can cause a lot of things to sublux or fully dislocate out. Her right hip has been dislocated for the last couple of days, and that's been causing some weird neuropathy down that quadricep on the right. How's the other foot?
It's fine. You're making me cold.
Oh no. Okay, so no focalized dystonia of the feet, which is good, but some click action going on just to read.
Ow, ow, ow.
Now what are you doing?
Okay, social distance.
Max,
Max, he's doing the right thing. He's social distance.
go jump on her. Give her some acupuncture.
No.
Absolutely.
Okay, I'm not going to be sick now.
Okay, can
That's
I have the sick
good.
bag? Pass me that then. Thank you. You're not going to be sick, so the anti-nausea has worked. Yay. What are you doing over there?
Oh,
Where'd you go?
comfortability. Oh.
Normally when she goes into this position, it can be part of the fatigue and into tonic close. She can quite likely go into a dystonic storm of seizures, so we're keeping a close eye on her. Oxygen stats are great, 98%. Heart rate is 72. 71. 70. 69. 66, 65, 64, 63, 62. Heart rate is going down, 61. 60. 59. 58, 57, probably going into syncope. Let's have a look. I would assume that she has actually gone into syncope at the moment, because that's why the heart rate sudden drop has occurred. Oxygen stats are good at 98 still. Just going to get the negative oxygen concentrator ready, because for some reason I have a feeling that we might be having an event.
Yeah.
Thank you.
Hey, what the?
What you doing? You back again?
It's cold. Why are you making me cold, please? Please, I'm cold.
You're cold. What would you like? Do you like the heaters on?
No, but turn it off. Oh, goodness, you're crazy.
Heaters are on. They're on at 25 degrees.
Turned it off.
Now, if you're new to the channel, first of all, welcome, and don't forget to subscribe while you're here. We are a family, a household, dealing with complex chronic medical conditions, particularly around the area of rare genetic conditions. John's got quite a handful of rare conditions.
On one side. Creepy.
Down the right-hand side?
Yeah.
Only on the quadricep or going down into the leg?
No, just
Okay.
side.
Irregular goosebumps can happen with neuropathy. So when neurological changes are occurring, you might see more patchy type goosebumps rather than an even distribution and equal bilateral type goosebumps in a response to, say, like a cold condition where goosebumps are there to generate the uprightening of the hair to actually keep the hair follicles and bring the warmth air into the skin. But with a neuropathy, they happen a little bit more differently for her. So you'll see them in irregular patches that occur. It's only 6:35. She shouldn't be closing her eyes and wanting to go to sleep. So we know neurologically she's going offline. We've already seen some syncope matching with a very sudden heart rate drop. That'll be an orthostatic induced syncope where she's not getting enough oxygen and blood to the brain. The dystonia is certainly there, and that's affecting the eyes. We're not seeing any other focalized dystonia as this point in time, and we certainly haven't gone into seizures. No, we're hoping that we don't. That's the theory behind things. The medications, the times that she's had those, should be enough to suppress, I'm hoping, or subdue. But remember, she's had the pre-ictal. She said she's had the nausea. She's had that feeling of dread. She's cognitively gone offline, and we can see the face is doing some irregular, weird things at the moment. What is 22q? What is the condition that Dyan's got? It is a microdeletion on the long arm of the 22nd chromosome. We have 23 pairs of chromosomes. 22nd is right next to the 21st, which is commonly associated with Down syndrome. With the 22nd chromosome, a microdeletion, it can lead into conditions known as DeGeorge, velocardiofacial syndrome, Schwitzen syndrome. There's a whole range of other sort of names. But these days we use the correct genetic terminology of 22q11.2 deletion syndrome. It actually represents that little space, that little microdeletion, that size there. Anywhere between 30 to 50 genes are actually missing in this condition. It affects 3 million DNA building blocks. They're just poof, gone, no longer there. And that contributes to anywhere up to about 185 different clinical symptoms. A lot of those Diane's got. She is autistic, ADHD, no CD. Autism experiences about 30 to 40% of those with 22q. ADHD is about 50 to 60% of those with 22q. 65% of them will have cleft lip, cleft palate, high palate related issues. 60% will have some sort of seizure or seizure-like type conditions. About 5.1% will have epilepsy as well. There's a whole range of things that come into this. The hypermobility, such as Ehlers-Danlos, the skeletal, scoliosis, impingements, those sort of things. GDD, global developmental delays. IDD, intellectual developmental delays. Failure to thrive, not just in size and height, but also with education and learning difficulties. It's a neurodevelopmental condition. Dyan does have microcephaly, so that's a small head circumference, a small space in the brain. She has been having a lot of cardiac related things, so tachycardia, arrhythmia, angina, the orthostatic intolerance. Arrhythmias are common. She's at the moment just going in the face. You can see the action at 6:38. So this is oromandibular dystonia, and eyes are the blepharism. She'll have a bit of bruxism, which will tie into grinding. She might have some jaw thrusting or tongue poking. This is all part of segmented cranial. Because of the neck and onto a left axial position, there's also got a bit of axial tilt dystonia coming in. We've got some seizure activity starting to occur through the left arm, focalizing a dystonia in the left hand, slight curling of the right hand. Hey, kitten. No. Oxygen stats are 95%. Heart rate is at 70. We have alarms on the devices so that we can keep an eye on her with audible alerts. The alarms are set to Met-Call standards. So with the oxygenation, saturated oxygen, it's set to a alert your foot. Leg. Arch your foot. This foot.
Yeah, cramping.
Okay, so we're getting focalized dystonia in the right foot. Bear with me while we do this. So as I was saying with the alerts, the oxygen saturation, if it drops to 90%, the alarms will go off. If the heart rate drops to 50 beats per minute, it will go off. If it goes higher than 120, it will go off. We're getting some distortion around the arm. Oh, sweetie. So with the body and the way it's going, we're actually getting some tonic-clonic seizures as well as a combination of the dystonia. Hey Google, set timer, 10 minutes.
Got it, 10 minutes. Okay. And that's starting now.
Thank you. Going to use Google Home Automation up the top there, just as a countdown timer as I keep an eye on Dyan. If the seizures become more vigorous, if they don't break, if it's continuing longer than a certain duration, then I will actually administer some ASM, anti-seizure medication. Hey, kiddo. So in this case, we'll do midazolam if that's what's necessary. In here, Bubba? Where? Where I am? Yep, in this right foot, yep. It's okay. I'm right here, sweetie. This will pass. There are certain thresholds, obviously, if they are sustained or hit, which will also then go to an ambulance level, where we'll then obviously code and go to hospital. But we will manage, this is a medically complex household. We are set up in this room to manage a lot of complex medical situations, have a lot of equipment and medications around that. But we wait to certain thresholds and certain sustained durations in thresholds before I get panicked about worrying about an ambulance. Well said, kitten. It's currently 6:41 p.m. Oxygen stats are 96, heart rate is 62. I've gotcha.
Sticky.
And sticky? Sticky down. Right, thank you. I'm right here. Can you see me at all? No. Dyan's right eye is almost fully closed. It's open about 5 mils. Dyan's left eye is open around about 8 mils. But with this, it'll be affecting her eyesight and vision. Cognitively, she may be totally out of it, not really understand what the actions are that she was doing, and nor may she actually remember the actions that she's doing, what she hears, or what she says. We have a complex multi-systemic situation where it involves and invokes things such as Tourette's and tics. It has the dystonia. Now the dystonia mostly will come from the basal ganglia in the brain. It affects the messaging, and those nerve impulses which control the muscles are out of her control, just as much as Tourette's, which is both motor and vocalized tics, are also out of her control. So the things that she says or does with her body actions, she can't actually manage to suppress or control. Likewise, seizures are also out of her control. She can't just wish them away. And we use the indicators such as the pre-ictal to know that something's going on, to hopefully apply appropriate medications beforehand, make sure she's safe, lying down, supervised so that she doesn't aspirate, doesn't hurt herself, doesn't dislocate, doesn't bruise with contusion, doesn't avulse with brain, with the tendons, or anything along those sort of lines.
No.
Hey, Bubba.
No.
How are you feeling? It's currently 6:43 p.m. Sunday.
Am I okay?
You are okay at the moment.
What's going on?
What's going on? At the moment, you've had some mild tonic-clonic seizure activity through your torso and the lower legs. You've had some dystonia. You've had some syncope where you're passing out. So you may still have some more. And I've just got a timer going. You're tired? Okay. Acute fatigue may be part of this. Okay. You can rest. That's perfectly fine if you want to rest. And we'll keep a very close eye on you to make sure that you're okay, alright?
I still will need custard.
You still need some custard. I bet you do. She wants some food. Once all this settles down, then we'll actually be able to address that. Obviously the nausea, through the use of 2 lots of 4 milligram on danzatron, has actually helped a lot in front of it.
I'm ready for custard. It's my happy food.
Custard is your happy food. That's cool. I just need to know that you're actually cognitively able to do and manage that, so that with dysphagia you don't aspirate and put the food down your air hole, and that you have the ability to be able to sit up and manage eating, and that you're not going to go into repetitive seizures while trying to do things. A bit of a twitch and a tick. Heart rate is at 57 beats per minute, and oxygen stats are at 98. We've been having some really irregular weird things going on in the last couple of days. We've had heart rate drops yesterday into the low 40s. The day before we're having heart rate spikes into the high 140s, 150s, sustained for long durations. They also coincided with oxygen saturation drops into the very low 80s, down to 82 the day before that. She had a cardiac event. That involved hospitalisation. The day before that she had a dystonia attack. The day before that she had tonic-clonic seizures and dystonia combined. Each and every day is a puzzle that we don't know what's going to happen. What's your jaw doing? Okay.
Make my custard thick.
Yeah, we'll make
I
your
won't
custard.
choke.
No, I'll make your custard when we're ready. Okay? So, alright, you just relax for the moment. Oxygen stats are 95, heart rate is 65.
So tired.
That's okay, you can be tired.
It's too early.
It is too early, but you are actually exhausted. And this is the thing also with chronic fatigue, another part of the condition. A lot of genetic conditions like Dyan's do have a fatigue element. And in fact, many of her conditions have fatigue. Even Ehlers-Danlos has fatigue as part of it. So when you get neutropenia and your body doesn't manage viral infections, and you pick up infections very, very easier, she crashes. So she can have things like recurrent EBV, Epstein-Barr, recurrent CMV, cytomegalovirus. She's already got Klebsiella, which is another type of infection that's been recurrent and very difficult to get rid of. So her body is fighting things. She's also got the shingles. This is a reactivation of the Zesta virus. Ticky. In these mixed neurological events, we may come out of tonic-clonic and then go straight into Tourette's. Do you get a break? No, she does not get a break, unfortunately. What you're seeing with the nose scrunching, the breathe type action, the face, the clapping, all of those are motor tic actions for Dyan, part of the Tourette's category. The dystonia is still engaged because it's still affecting the eyes and the eyelids, eyebrows. Yawns are what we look for in the post-ictal phase of seizures for Dyan. When she gets some really good generation of yawns, normally I know, hey, most likely the tonic-clonic phase has subdued, has gone out, and her body's in recovery phase. It's also gathering in more oxygen, so oxygen starvation can be part of it, so she's sucking it in, but it's also a sign of more relaxation. She's let go of the tension that tonic-clonic seizures can actually have as part of this condition as well.
Yes, I can't fall asleep. I don't wake up.
It's okay, I'll wake you up, even if you have a nana nap just for a few minutes. I just want to get rid of these seizures for dystonia. I want the syncope to pass away, all these nasty things, and the Tourette's to settle down. Having a close look at her face and what that actually does as it goes through this as well. So you can see the eyelids, eyebrow movements, the flaring of the nostrils, the upturn of the left-hand edge of the lip. All these are part of the generalized segmented dystonia in the face. Maximus is floating around somewhere. There's no focalized dystonia in the feet. I can't see any in the hands at the moment. He's around somewhere, Bubba. Just relax, please, for a moment. With the fatigue, as I was saying, after getting originally Epstein-Barr virus in her late teens, Dyan went on to have post-viral syndrome, chronic fatigue syndrome, and then, as it's now called, ME/CFS, myalgic encephalomyelitis chronic fatigue syndrome. It includes post-exertional malaise. Quite commonly you'll see orthostatic intolerance or the POTS as part of this. Your body's not a happy camper. So many different things all over. Dyan is under 24 different specialists at the hospital, and I met with the hospital executive team last week to actually improve engagement and accessibility for her care with a person who's mostly bedbound, has complexities of communications through autism, and particularly the conditions coming under 22q. Another one of the big yawn. That's about the third big yawn that I've seen. So my fingers across at the tonic-clonic seizures. You want to watch some TV? So do I. It's a Sunday afternoon, evening. Then have some custard. Well, if you stop having seizures and dystonia and relax, we'll be able to. And hopefully this will pass in the next half hour or so. And Dyan will be, hey Google, stop.
Shut up, Google.
She still has the energy to tell Google off. That's gorgeous. Other parts of the 22q that we're managing: CCI, cervical cranial instability in the neck. We need to actually get a CT scan of that. She's had a bad fall a little while ago, particularly with atonic drop seizures. She's hurt her left hand. She needs a CT scan of the left wrist to see what soft tissue injury has actually occurred or skeletal base damage that may have occurred. Dislocations and subluxations are occurring all the time, so we're waiting for neuro-orthopedic and orthopedic surgery to actually review Dyan, both for her Hillman sac injury of her right shoulder, her glenohumeral joint, because that had a full anterior dislocation and has never ever healed properly coming out of that. Patellar dislocations are very common in patients with 22q with the knee going out, so we need to look at the stability around that. Neurology needs to investigate and support her for all the ataxia and the walking related issues, the migraines, the dystonia, the seizure types. Snack, crackle and pop. That sounds like a breakfast cereal ready to eat.
That's my body.
That's what your body does. Yes, your body snaps like a glow stick, doesn't it, with EDS?
Chocolate milkshake anyway.
But only crunchy?
I want the toys in the cereal to come back.
You want the toys in the cereal, breakfast cereal to come back.
I have discs.
You have Disney discs, yes, from the Woolworths collectible. You put them up there somewhere. Just relax, Boo, for the moment. I just want to get this out of your system.
I like them.
Yes, Woolworths, thank you very much. You've got another collectible incentive program going on with the Disney discs, which Dyan does like, but it means having to go to shop at Woolworths. Hello, Maximus. You've come to say g'day as well, have you, buddy? Hey? Thank you for coming and helping. I've just finished cleaning the bird cage fully. The birds are happy. They've got a nice fresh cage. They've got fresh food. They're all enjoying life.
Max.
Max is here. He's just at the end of the bed. He's floating around. So also we're waiting for a range of other specialists, cardiology to obviously do their thing, vascular surgery to help and assist because Dyan's got full body edema quite commonly as well as lower peripheral edema, affecting about 3 kilograms of water weight that she can't clear away. Gastroenterology, they've put a procedure on pause because she's not stabilised with heart, breathing and seizures at the moment. Respiratory, working to try and get oxygen solutions, which we're doing through the NDIS. Infectious disease team, working off the back of urology and gynecology because of the Klebsiella. We're actually waiting for a gynecology appointment as well. We've got to see dietitian from the gastroenterology team. Blah, blah, blah. Yourself. That's one of her vocalized tics as well from the Tourette's. Hey, kitten, are you coming back around a bit more? I don't know, you're a bit tired.
That must have been it was a big party.
Big
Not
party.
for them, for me.
There's a very big event just for you
For
getting
me.
up, having a bath, and going and getting dressed and going out for half an hour. Just down the hallway, literally just down the hallway. You dressed lovely. You wore your new top from Shein.
$18.
$18, yes it was, from Shein. There you go.
It's a jacket.
It's a jacket. She
It's
loves her budget bargains that she gets from Shein.
jacket.
Did you look professional?
I looked it, but I don't feel
You'll
it.
notice that the right eye is totally closed, left eye is mostly closed
I
at the
can't
moment.
afford a Kmart jacket.
It's because of, again, the basal ganglia
And
communication
it's
to
big.
those components not being able to allow those muscles actually do what they need to properly do.
Why is Kmart?
Dyan's also got a bilateral calcification of the basal ganglia and a movement disorder, which is also in part called FARS disease, yet another type of condition.
Vibrating, you turn into calcium.
Yes, you do. You've got lots of calcium spots around your
So
body.
I can feed the budgies
Over,
calcium.
you could actually. Hypocalcemia is also a landmark condition as part of having
Is it
22q.
over?
I don't know, Bubba. You got to tell me. Feeling upset after a seizure is also incredibly common. Some of the other misnomers, biting in the inside of your lips, cheek or tongue can sometimes occur in vigorous seizures, probably only about 30% of the time. Wetting self-urinating sometimes occurs, probably only about 25% in certain types of seizure types. Dyan quite commonly goes to the toilet urgently before an actual seizure. What's happening, fingers?
You know what?
What?
I was having a great day.
You were having a great day, and you're going to have an even greater night once this is over. We've got you. Your signs and indications are good. We've got no alarms going off at the moment, which is nice to have. And I'd say that the medications we've got in front of things just in time.
My body's being good now.
Good. Well, I'll tell you what, last night was exhausting for you. Having gastroparesis with bowel dysmotility of the GI tract, it's horrendous. Nothing passes through, and you need to bring out the industrial strength laxatives. Well, we apply the industrial strength laxatives early yesterday afternoon, went through the early afternoon, late afternoon, into the night. And of course, she has then had to go to the toilet throughout most of the night and early morning.
3 times.
3 times. And that's exhausting because it breaks all your sleep patterns. There's Maximus.
Oh, goodness.
Hello, our little baby ragdoll kitten. Whereas Willow, he's right here in the tower, just sleeping. He's an old guy. He's 8 years of age. Oh, big purr purr. Are you helping Mummy to wake up and say, right, that's it? She's had lots of yawns, so definitely could say the tonic clonic seizures are done, which is nice. The dystonia from the face hasn't released yet, so I can see that through the blepharism.
Is he waking me up?
He is. He's just cuddling you at the moment. He's connecting and saying, "G'day, Mum."
Maxie?
We're going to do some vital checks and see what's actually happening. So oxygen stats at 97, which is really good. There's been some flapping, some down to about as low as 82% during it. Heart rate currently is 59. Again, a bit of flapping going on. The fatigue is definitely real. I think that we've had enough of medications just at the right time to try and prevent a really major sort of scenario. So that's actually really nice. Let's see what her temperature is doing at the moment.
He's the best nurse ever.
He is a great nursing cat.
Max, you're so nice.
Temperature's actually gone up a little bit. It's 37.4. Originally it was 37.0 before.
He's massaging my leg.
Can you lie on your back for me, please?
No.
Thank you.
Max is massaging his masseuse.
Max, the masseuse is not helping at the
He
moment.
doesn't understand your style of nursing.
Would you like me to check your blood pressure, Max?
So say no, Max. It hurts the arm.
It's just a little gentle
No,
squeeze.
it's not.
It is just a gentle
It's
squeeze.
intense.
Can you stop flopping your arm?
I'm trying. I'm not feeling very strong.
You're not feeling very strong. Right, you need to sit still and quietly.
Make biscuits, Max.
Okay, no, you're not allowed to touch
He's
the blood pressure.
nurse.
No. Beep,
Good boy, Max.
beep.
Max.
Right. Let's see what we get as a blood pressure reading then. Just relax, please. I can hear your motor running. Whereas Mum, we've got check engine warning light on at the moment and there's smoke coming from underneath her hood. We need to work out what's going on for her. What do you reckon? And with the fatigue, I think she needs a battery replacement as well. Bit of an howl coming from Dyan. Right, blood pressure has gone down to her fairly regular sort of levels, 89 over 60, and a heart rate of 56. So I'm happy with those levels returning to a normalised range for Dyan. Temperature's increasing a little bit, and I probably will keep an eye on that because I might have to encourage some Panadol Osteo if it goes into more of a fever. But it is incredibly cold, so the incredible cold, that's why I'm all rugged up. I don't normally rug up like a Yeti. The incredible cold is actually helping us all at the moment keep the fever under check. Oxygen stats at 96, heart rate is 63. The nausea has gone.
Nurse Max and I are just resting.
That's great. Are you feeling a little bit better now?
I am.
Great, it's 6:59 p.m.
Well, my eyes are heavy.
Your eyes are heavy because the blepharism is still engaged in your face.
Max is trying to wake me up.
We might have to actually apply a bit more of the clonazepam soon if it doesn't actually release fully. Hey Maxie, are you helping? Good boy.
Are you helping me?
Are you the best assistive support cat or what?
You're the best.
Hey? That's a cool thing to wake up to after you've had a bad, painful seizure or feeling uncomfortable or not feeling too good. Hey, that's not a bad thing at all, is it? Look at this.
Thank you for your love, Max. You're very kind to me.
Oxygen stats at 98%, heart rate is 58, blood pressure has gone back to a normalised level. The dystonia seems to be releasing. It's only left in the face at the moment. The seizures have certainly gone and left the building, which is a nice thing for us. We've had no chest pain over angina. I haven't heard of any arrhythmia.
Max magic.
It's the magic of Max. That is brilliant.
Max, high five. High
Respiration
five.
levels have been
High
good,
five.
so oxygen saturation I'm happy with during this phase as
You
well.
want to get up? Okay.
So I'll put this
Is your
down to
shift
just enough
over?
medication at the right
His shift
times.
is over.
His shift is over. Thanks, buddy.
He said he's leaving.
We appreciate that.
He said he's going.
Well, you're
to
coming
the
to see me, have you?
chickens.
He doesn't need to see the chickens.
Oh.
Guys,
He's
thank
telling
you.
me to social distance.
Max, I'll let you have some time with Mummy, okay?
Oh.
Just for a little while before you come back to Daddy.
Oh.
Oh, licky licky. Mummy doesn't like the licky licky. Not at all. A little bit too much on the licky.
You can't kiss me. We're not humans.
Oh my goodness. Hey guys, thank you as always for being around,
Yes,
watching.
I'm
We're doing
yours.
this to
I'm
advocate
yours.
and
I'm all
educate
yours.
for chronic, long-term, rare conditions, genetic conditions such as 22q, Ehlers, Danlos, ME/CFS. The collection is there that Dyan's got. She has autistic ADHD, OCD, and has the Tourette's as well. You can see the mixed neurological bag that occurs. You can go in between, in and out of having things like tics and motor tics with Tourette's. You can have, obviously, the dystonia
okay.
just before it goes
I'm
into
okay.
things like tonic-clonic seizures.
I'm okay.
It's amazing how the brain is operating and
I'm
working.
okay. I'm
If I was asking
okay.
her to walk right now, you'd then
I'm
see
okay.
walking difficulties with gait issues,
I'm
maybe even
okay.
falling. It is a mixed bag.
Okay.
So thank you very much for watching.
Why?
Give us a big thumbs up of support
I'm
for
okay
Dyan.
now.
If you have comments, questions, ideas, or suggestions, please leave them below in the comments
I'm
section. We'd love to
okay.
hear from you and your engagement. Give a big thumbs up of support to Maximus. Max the nurse. He is such a good boy.
Such a good
He is
support cat.
such a good support
I'm
cat.
so glad and
You are
grateful
so helpful,
I
mate.
have you.
You really are.
It makes me feel
Makes all the
secure.
difference, doesn't it? If you're new to the channel, don't forget to subscribe, hit that notification bell.
Kitty.
I'll be keeping a very close eye on her, and so will young Max, won't we, buddy? We're going to look after mummy as we go
Do I
through.
get
And obviously, custard.
soon?
This is your Google
Custard.
Nurse.
Hey Google.
TV. He's telling you
There are
something.
a lot of great shows on TV.
Hey Google.
You're having
Stop. Google heard your voice while he was giving you an instruction about medications, and he thought that you needed a TV program. So Google was being a little bit too over assistive, and you've already had your
What?
CBD as part of this
Oh my
cycle.
goodness. No, but I've already got a TV. We've already got a TV.
What?
We already have a TV recommendation.
Dyan's
from a lady
cognitively
today.
after seizures can be a little bit of a
She's already
confused
given
stage.
us a good
Difficulty with memory,
direct
recall,
of an
retention.
ABC TV show,
Mhm.
which we're going to do.
We are based in Tasmania, where we have some lovely people already, such as Willow and Cam from Tasmania.
Yes, that's correct.
Exactly. So we're going
And
to check
so
that
we-
ABC show. It's up to season 2 apparently.
Yes.
Mm-hmm.
So,
We will suss that out.
but Google keeps talking inappropriately.
He's not talking inappropriately. He's trying to help you.
No.
He was
No,
listening to
no,
your
no.
voice. He listened to what you
Okay.
said. He
No,
thought
don't take
suggestive
advantage of
AI.
Don't take advantage of my lack of cognition here. Listen,
Okay, we're listening.
we've been chatting lately, just in between watching TV,
Yeah.
and then Google randomly just says stuff.
Okay.
It's rude.
You just said Google just said, so if Google speaks up in a moment, I wouldn't be surprised.
So Google, don't just interrupt my conversation.
Google's trying to help.
Okay? There's a manners
The
protocol
autistic
thing.
communication between AI and
You
not.
obviously have autism and ADHD, and you don't know when to speak and not to speak.
Turn taking is important.
I have the same problem. We must learn.
You're having a conversation with an inanimate object, honey.
There is no such thing. Everything has feelings.
Objects and Google does not have feelings.
He is so off the job.
Max, he's relaxed. He's chilled.
Max.
Anyway, I'm going to get off the job. I'm going to go make you some custard. You need to relax. You feeling better? A little bit?
Yes and no.
Yes and no. It looks yes and no. How about you lie down, relax, and I'll go make you some custard. Deal?
I didn't miss anything today. It was all cool, right?
Yeah. She'll watch
Not
the video
much.
back and go, oh, did I say that?
Happened,
Did I do
right?
that? Bit of dystonia, a bit of seizure, a bit of
No,
syncope.
I
A lot of fatigue, rolling over, very tired.
feel like crap.
You do look like crap. You need a good sleep. Catch up tonight.
I want to live.
That's what we're trying to do. Keep you living. All right, guys. Love you. Leave you. We'll see you soon. Bye for now.
Right.